London Royal Free Hospital is about treating infectious diseases. All suspected COVID-19 patients are being quarantined in isolation bays. Jonathan says we are delivering intensive care at the front door. Peter, 88, arrived in A&E with breathing difficulties and his blood was dangerously low. Visiting hospital is limited due to COVID-19, so he will be alone. Doctor says putting you onto a life support machine, artificially keeping your heart and other organs alive, would not deliver a good outcome. Peter has a do not resuscitate request, means that if his conditions worsens, he won't go into intensive care. Doctors say they are going to be strict on rationing care. Sean says there is no cure for them, all they can do is give them the best nursing care. Nancy is a community nurse who has been on the ventilator for 13 days. Professor Martin is the only surgeon to perform this unique case. They managed to free up the airway and leave a smaller tube to replace it. However, she has not recovered. There are about 50 people in hospital who is in Peter's situation and who they have to make an assessment on. Peter's lungs dramatically removed after 12 days after no being able to breathe. Doctors must contact family members to keep them informed of their condition. Senior team is trying to decrease pressure on intensive care. ICU matrons discusses the increased number of patients who have COVID. What they plan to do is swap the recovery patients with one who is ill of COVID-19 patients but still want them to have quality care. Kay speaks about the need to move patients with chronic conditions from a floor to another floor. As one patient comes out of the theatre, one patient goes in. ICU matrons managers were in charge of looking after COVID patients. Filming in intensive care is allowed, using body-worn cameras operated by the matrons. The temperature in the ward is very hot. They can't take a drink without their kit on, staff feeling the stress and the pressure. It's usually one-to-one nursing in ICU. They will not be able to give patients the care they normally get. Workers are angry at the nurses. The staff eventually start calling in sick and same of then now are self-isolates. They were ICU nurses. They are seeing their colleagues in intensive in unit. To free up more bed space for COVID patients, all non-urgent operations have been cancelled. They are terrified to be in there. Sanjay Bajor describes Nancy after the treatment. They learnt a lot. 22 Sabina is 36 weeks pregnant and has COVID problems. Sabina's husband Patrick can't be in the ward because of infection risk. Caesarean section because we're worried she's going to get worse, and so they want the baby out because being pregnant reduces your respiratory capacity, says Jane Lowry. This will allow her to breathe better. Jane first COVID baby. Khaled Bazanti, the pediatrician, remains on standby outside the theatre. Baby came out, the woman was fine and she can breathe a bit better now. Emergency team waiting outside the hospital was not need. Investigation will be done on her and the baby in months to come to see if they are okay. Rebecca speaks to another doctor and says that they were able to transfer the patients to Barnet Hospital. April Fagan speaks about patients bringing their stuff to the storeroom. They are not sure if their person has survived E2 or is in still E2, so their stuff is left in the junk space. Nancy needs physiotherapy as part of her recovery. Thanks for watching. Like, share, comment and subscribe.